Welcome everyone to Deny Delay Depose, Health Over Wealth. Today we're diving into some heavy stuff. It's not all doom and gloom, but we definitely need to talk about the connection between generational trauma and why we're facing such a crisis in healthcare staffing, especially in those underserved communities. It's a mess out there.
It is a mess, and a volatile one at that. Welcome, everyone. I think it's all connected. The Mangione case really exposed the tip of the iceberg. Today it's healthcare, tomorrow it's something else. The system is so broken, it will break everything around it. It needs a major overhaul. I think Mangione's martyrdom.
Whoa, hold on, Otto. Martyrdom? Let's not get ahead of ourselves. The situation is complicated. There are definitely issues with healthcare access and cost, but let's not paint it like the whole system is collapsing. It's more like it needs some serious tweaks within the existing framework. Welcome, everyone. I think when we have this discussion, we have to keep in mind economic realities.
Tweaks. Sarah, with all due respect, we've been tweaking for decades. It's like putting a Band-Aid on a gunshot wound. Look at the news. India and Pakistan on the brink again, a new pope being selected, and Trump still stirring the pot. All these things affect people's stress levels, their access to resources, and ultimately their health. It's not just about insurance premiums, it's about the whole damn ecosystem.
Exactly. It's all connected. The constant state of crisis, the inequality, it creates this undercurrent of stress and anxiety that disproportionately affects marginalized communities. That stress manifests in physical health problems, and then who's there to treat them? A healthcare workforce that's already stretched thin, burnt out, and often carrying their own generational baggage. It creates a loop.
Okay, I agree that stress plays a huge role, and those international tensions definitely add to it. But you can't just say the entire healthcare shortage is because of generational trauma. There are so many other factors, like the cost of medical school, the demanding hours, the increasing amount of paperwork and regulatory burdens. You can't simplify it down to just one thing.
Nobody's saying it's the only thing, Sarah, but to ignore the historical context, the systemic racism, the poverty that's been passed down for generations, is to miss a huge piece of the puzzle. Think about communities that were redlined, denied access to education and jobs, and then poisoned with environmental toxins. Their distrust of the healthcare system is earned, and it's going to take more than just a new clinic to fix that.
Yes, and it's not just distrust, it's the lived experience of being treated differently, of not being heard, of having their pain dismissed. That trauma gets internalized and passed down. And you know what? It's the same trauma that contributes to the healthcare worker shortages. People see their families struggling, getting sick, dying early, and they don't want to subject themselves to that system. Or they go into it idealistic, and then get crushed by the bureaucracy and the ethical compromises.
Okay, I see your point about distrust. I really do. But what practical steps can we take to address that? You can't just wave a magic wand and erase decades of history. How do we build trust, incentivize people to enter the healthcare field in these underserved areas, and make the system more appealing given the current economic situation?
It starts with acknowledging the past. Reparations, for example, could be a start. Investing in education and job training programs in those communities is essential. But more than that, we need to change the whole damn incentive structure of healthcare. Why are we prioritizing profits over people's lives? Why are insurance companies allowed to deny claims and pad their bottom lines while people are dying?
And we need to empower communities to take control of their own health. Community-based clinics, staffed by people who look like them, who understand their culture, who speak their language. We need to decolonize healthcare. You know? It's been this top-down, paternalistic system for too long. We need to center the patient and the community in the decision-making process.
Those community-based clinics sound great in theory, but how do you fund them? Where do you get the staff? And how do you ensure they're providing quality care? You can't just throw money at the problem and hope it fixes itself. There needs to be oversight, accountability, and a sustainable funding model.
Oversight and accountability are essential, but the funding model, that's where we need a fundamental shift. We're spending more on healthcare than any other developed nation, and we have worse outcomes. Where's that money going? Into the pockets of CEOs and shareholders? We need Medicare for all, or something similar, to take the profit motive out of the equation and ensure that everyone has access to quality care, regardless of their income or zip code.
Absolutely. And Medicare for All isn't just about coverage, it's about shifting the power dynamic. It gives individuals more leverage against insurance companies and hospitals. It allows us to negotiate drug prices. It frees people from being tied to their jobs for health insurance. It creates a more just and equitable system all around. It would be something that could have changed Mangione's state of mind.
But Medicare for all would be such a massive disruption to the economy. What about the insurance companies? What about the jobs that would be lost? And how do you pay for it? The taxes would be astronomical.
The disruption is already happening, Sarah. People are going bankrupt because of medical bills. They're delaying treatment because they can't afford it. They're dying because they don't have access to care. As for the insurance companies, they can adapt. They can become care coordinators or focus on supplemental coverage. And the taxes, yes, they'd be higher, but people would be paying less overall because they wouldn't be paying premiums, copays, and deductibles.
And think about the economic benefits. A healthier workforce is a more productive workforce. People aren't stuck in dead-end jobs just to keep their insurance. Innovation is unleashed because people can take risks and pursue their passions without the fear of losing everything if they get sick. It's a long-term investment in human capital.
Okay, you're making some good points about the potential benefits, but I'm still worried about the practicalities. How do you transition from the current system to Medicare for all without causing chaos? And what about innovation? Won't removing the profit motive stifle research and development of new drugs and treatments?
The transition would be complex, no doubt, but other countries have done it successfully. We can learn from their experiences. And as for innovation, there are other ways to incentivize research besides letting drug companies gouge patients. Public funding, grants, and prizes can all drive innovation without sacrificing affordability.
And let's be honest, Sarah, a lot of the innovation we see now is just about finding new ways to make money, not necessarily about improving patient outcomes. We need to shift the focus to preventative care, to addressing the social determinants of health, to empowering people to take charge of their own well-being. That's where true innovation lies.
So you're suggesting a more holistic approach.
Absolutely. It's not just about treating disease, it's about creating health. It's about addressing the underlying causes of illness, whether it's poverty, pollution, or generational trauma. We need to create a society where everyone has the opportunity to thrive, not just survive.
And that ties back to the healthcare worker shortage. When you create a system that's based on compassion, on equity, on social justice, you attract people to the field. People want to make a difference, to help others. But they don't want to be cogs in a machine that's designed to extract profit from suffering.
Okay, that makes sense. So if we're talking about concrete steps, we need to address historical injustices, invest in underserved communities, and move towards a more equitable healthcare system. But how do we actually get there politically? I mean, there's so much resistance from powerful interests.
It's going to take a movement, a groundswell of public pressure. We need to elect leaders who are committed to healthcare as a human right, not a commodity. We need to organize, advocate, and demand change. It's not going to be easy, but it's absolutely essential.
And we need to be willing to challenge the status quo, to disrupt the system, to even risk. Maybe Mangio knew that. Risk everything for what we believe in. I think that's the spirit we need to bring to this fight. This is not just about healthcare. It's about creating a more just and equitable world for everyone. Maybe it's a world without Donald Trump, maybe with.
Okay, let's not get too carried away. I agree that we need to advocate for change, but let's focus on realistic goals and achievable strategies. Incremental steps can be powerful too, like expanding Medicaid, negotiating drug prices, and investing in community health centers. We don't have to tear down the whole system overnight.
The incremental steps haven't worked, Sarah. They haven't addressed the underlying problems. We need to be bold. We need to be ambitious. We need to demand a healthcare revolution. Anything less is just rearranging the deck chairs on the Titanic. Now the Pope is about to be selected for 1.4 billion Catholics. That could impact access to healthcare for many.
And this new conflict between India and Pakistan, that's going to have ripple effects throughout the region, impacting healthcare access, mental health, and overall well-being. Everything is connected. We can't afford to ignore the bigger picture.
Yes, and we can't forget about the individuals working within the system right now. We need to support our doctors, nurses, and other healthcare professionals who are facing burnout and moral injury. We need to create a work environment where they feel valued, respected, and empowered to provide the best possible care.
Exactly. It's about creating a culture of care, not just for patients, but for providers as well. We need to address the systemic issues that are contributing to burnout, like excessive paperwork, unrealistic workloads, and lack of autonomy. And we need to provide mental health support and resources for healthcare workers who are dealing with trauma on a daily basis.
And it's about celebrating the healthcare heroes, the people who are putting their lives on the line every day to care for others. We need to elevate their voices, to listen to their experiences, to learn from their wisdom. They are the ones who truly understand what's broken in the system and what needs to be fixed.
So, it's a multifaceted problem with multifaceted solutions. We need to address the past, invest in the present, and build a better future. It's a long road ahead, but it's one worth fighting for.
Absolutely. It's about creating a healthcare system that's worthy of our values, that reflects our commitment to justice, equity, and compassion. And it's about creating a society where everyone has the opportunity to live a healthy, fulfilling life. Let's not let Manjoni's apparent sacrifice be in vain.
That's right. A world where health isn't a privilege, but a right. A world where healing is prioritized over profit. A world that would be radically different. A world where something like the atrocities between India and Pakistan don't happen as a result of economics, rather than the other way around.
And a world where we appreciate the complexities of these challenges and work towards solutions that are both idealistic and pragmatic. Thank you both for this important discussion.
Thank you both, and thank you to our listeners for joining us. Keep fighting for health over wealth. We'll see you next time on Deny Delay Depose.
See everyone, stay strong, stay informed, and keep pushing for change.